Okay, now let's talk about the posterior urethral valves. Posterior, just as the name mentioned, posterior urethral valves. The valves in the membrane remnant in posterior prostatic urethra in males. Okay, its persistence can lead to urethral obstruction. Of course, the valves are going to cause obstruction. Diagnosed prenatally by bilateral hydronephrosis. Of course, if the urethra is not the urine is not going forward, it's going to go back. When it's going to go back, you know that when it's going to go back, it's going to cause, first of all, hydroureter, meaning increase in size of that ureter right here, hydroureter, and that eventually will cause hydronephrosis. So look at this picture, very important. Look, that's what I'm trying to tell. So you have the kidney, the ureters, the bladder, the urethra. Now we have the valves, the posterior urethral valves here, and now they are going to obstruct the urine. So it's going to go back. It's going to cause distended bladder, which is so much distension of the bladder all the time. It's going to cause hypertrophy of the bladder wall, and that from there, that all that pressure buildup is going to go back to the ureter, causing urinary reflux back, causes hydroureter, not thickening, but dilation of that ureter. That same urine is going to go back into the kidneys, causes hydronephrosis. That is seen with posterior urethral valves. Okay. So you can diagnose by bilateral, and one more thing, it's going to be bilateral hydronephrosis. Why? Because we only have one urethra, right? So if that is blocked, the pressure is going to go here, and also the pressure is going to go on the other side. So bilaterally enlarged kidneys. So bilateral hydronephrosis and dilated thick-walled bladder on ultrasound. Severe obstruction in fetus associated with oligohydramnios, most common cause of bladder outlet obstruction in male infants. So let's talk about now vesicoureteral reflux. It's a retrograde flow of urine from bladder. Now look, let's just look at this same picture. From bladder up towards upper urinary tract. From bladder goes up. Okay. Why did it go up? Because primary due to abnormal insufficient insertion of ureter within the vesicular wall, which is the uretero-vesical junction. Okay, one thing is, so we have the bladder here. They're saying primary, it is due to the fact that the ureters, when they enter the bladder, there's an abnormal insertion of that ureter into the bladder. So instead, when the urine comes down into the bladder, this closes. But now here, what you have is when you're urinating, the pressure is going towards the urination, and also the pressure is going back because of that abnormal insertion of the ureter into the bladder wall, which is now called uretero-vesical junction, or secondary to abnormally high bladder pressure. Or if you have so much high pressure here that you are kind of pushing it towards any orifice that you can find, so that is, it's going to go towards the ureter as well as up here if you have the bladder pressure, resulting in retrograde flow via the UVJ, increased risk of recurrent UTIs. Okay. So to illustrate this UV junction, UVR, vesicoureteral reflux, let me just, so normally what you have is from the bladder, you have when the ureter come and then join in the bladder, you have an oblique angle. You have an oblique angle, so nothing can go there. But in this case, in VUR, you have formed an abnormal perpendicular type of angle. So that's the wall and that's the angle. So when the pressure in the bladder increases, the urine goes back. Okay. And this would cause, because the urine is going to go back, right? So it's going to cause bacteria seeding into the kidney, causing recurrent pyelonephritis. Recurrent pyelonephritis, if it is not fixed. So because the urine is going back all the time, it's going to cause recurrent pyelonephritis. Pyelonephritis with kidney, involvement of the kidney here. And then you have this, if not fixed, if you don't fix this, then it can lead to loss of that nephron. So because you have the recurrent injury to those nephrons recurrently occurring, if it is not fixed, you can cause loss of nephrons and secondary hypertension now. Okay, so that's pretty much all we have at the Vesicoureteral reflux.